Consider this, a news and information program recorded on the campus of the University of Nebraska at Omaha. From the Fireside Lounge in the Milo Bale Student Center, here is your host, Carol Schrader.
Hello and welcome back to the University of Nebraska at Omaha. It is appropriate that we were in this milieu to talk about the subject we're talking about this week. It is HIV/AIDS Awareness Month, and we are talking about something that is not under control by any stretch of the imagination in this country. And then you can extend that to all sexually transmitted diseases, where we have epidemic proportions in some parts of our state and some parts of Omaha. I'm very proud to have the guests I have here today because they've been working very hard in this area. Jamie Grayson is with the Nebraska AIDS Project, the only statewide HIV/AIDS information and prevention service. And she's coordinator of two programs, Women on Top and Street Dogs, yes, which we'll hear more about. Also with us is Ramon Henderson. He is in the private world. He's CEO and president of the Henderson Group. He likes to help people make more money. But in his philanthropic role, he is with 100 Black Men of Omaha. He is their health and wellness chairman. And he helped start, in the name of 100 Black Men, as the lead agency, the North Branch Health Coalition, which we'll touch on too. Also, last but not least, is Kevin Ballou. He is an STD project specialist with the Douglas County Health Department. And since it is the largest county in the state with the most people and the most STDs, maybe I'll just start with you, Kevin. People are kind of in denial as parents, citizens, that HIV/AIDS is still around, that it's increasing, and that other STDs are growing too.
Correct. A lot of that is associated, especially in Northeast Omaha and Douglas County, with the stigma that still surrounds HIV and AIDS. The Black community traditionally has been a very conservative community, and discussing issues related to sex and sexuality is something that's still tabooish in the community.
And the origination in this country, anyway, of AIDS was, 23 years ago, and it was white, gay, male. So everyone is either in denial, in my opinion, that the demographics have changed drastically, or they would just rather not think about it at all.
Absolutely. Well, as Kevin indicated, especially in the Black community, it's something that we don't want to accept as a reality, that homosexuality is in our community. It's even in a lot of places that we don't want to name. It's in the churches, it's in the schools, it's everywhere. And it's something that we have to address. We have to start talking about it openly, because the open dialogue is what's really going to get us to start addressing it to everybody. Not that we embrace it. I'm a part of the ministerial staff in Omaha.
That's right.
I don't embrace homosexuality. I don't believe it is the will of God in the sense of sexuality as far as man and woman's concerned. But it is something that's in the community and needs to be addressed openly so the dialogue can continue. We can educate appropriately all behaviors and maybe begin to curb the way this thing is being transmitted further. So.
Well, and what's happened is that because some people, I'm not saying yourself, are not approaching this because it was a white gay male disease, are living in la-la land, because now, and you certainly know this, that the female population, because of heterosexual transmission, in large part, are getting AIDS and HIV in too high numbers.
Well, and we can look at the issue of homosexuality as possibly being a route through which transmission is occurring.
Correct.
However, when we talk about transmission rates amongst women, the leading cause is through heterosexual transmission, and above and beyond that, that is the leading cause of new HIV infections across our country is through heterosexual transmission. It's no longer, like we have been talking about, the gay white man's disease.
No, in fact, in the Latino and African American population, it's disproportionately increasing.
Well, when we look at our state's population, 4% of our state's population is African American and 6% is Latino. 10% of our population comprising of two minority groups. However, they comprise half of all the infections that we are looking at with regards to HIV in the state. That is completely and totally unacceptable and disproportionate.
But part of it, I think, is lack of education, and I'm not saying anyone is ignorant, but look at our newest residents, our Latinos, and it's difficult for them to get information on any kind of health information because of the language barrier.
barriers.
So
Correct.
they're in a more, I guess, a scary position from an information point of view. But even in the African American community, the primary network for dissemination of information is churches.
Yes.
It still is.
Yes.
It is one of the strongest,
Yes.
also in the Latino community.
Right.
And so when you have a little bit of a disconnect or a lack of connection with talk real about sex, and if we don't talk about it, they won't do it.
Right. Well, it is. It's very hard when you have a spiritual conviction in one sense that says that abstinence is the only policy that you should be preaching and teaching, but also understand that there's a lot of people in the community that don't hold that conviction, and homosexuality is a part of that as well. How then do you openly embrace a conversation that contradicts or begins to challenge your very convictions? How do you speak to it without saying or feeling as though you're opening your arms, you're welcoming them into the process, you're saying it's okay?
It's okay to have sex, teenagers, because we need to talk about protection.
Right, right. And
So
it's-
that you're saying that's what you're putting the imprimatur
Right.
on these kinds of things.
Right. It's
And
that dialogue that really becomes a contradiction that is in the church, and it's hard. But for instance, I offer this one: the whole condom distribution use. Should you pass out condoms?
which they did here at UNO
Yes.
recently.
Should you actually pass them out? Again, from a spiritual conviction standpoint, you don't want to give an endorsement on sex before marriage. You don't want to give an endorsement on anything except abstinence. However, we know Douglas County was mentioned earlier of the STD epidemic that they have with chlamydia and gonorrhea. The numbers of young African American kids between 15 and 24 are skyrocketing. These are children that are not practicing abstinence. So should I go out there and beat them over the head with an abstinence message only? Or should I also begin to engage their conversation to let them know that their behavior alone is something that they need to address? So are you not wearing condoms at all in your sexual behavior? Not that I approve of what you're doing.
But is that you can take the majority of Latinos and African Americans are Christians. So let's just talk about that. So you can say, would Christ want me to ignore the problem, the very human problem that this young person has, and not talk frankly about? Well, it would be really Christian if you didn't do it. But it wouldn't be Christian if you passed something on.
Right. Right.
Well, and it's looking at
Or got
HIV
it.
and STDs more, as opposed to looking at it as a moral issue, we need to be looking at it as a health issue. Like you're saying, regardless
Absolutely.
of the fact whether or not they are practicing abstinence, we need to be talking about protecting them if they aren't. It's the concept of harm reduction, which I know Kevin is extremely, and Ramon is also extremely familiar with, that we accept people where they're at and we embrace them where they're at, and we teach them ways to reduce the harm in what they're doing. If that means with doing street outreach, we work with people who are IV drug users. Telling an IV drug user to quit using drugs right now is probably not a realistic expectation of that person. But if you're going to keep using, I don't want you to also have to deal with HIV or hepatitis. So let me show you how to keep yourself healthier and clean your needles. It might not be the most popular approach to handle dealing with these epidemics, but it can at least maybe get us to a point where we can get some kind of grasp on it and then go from there.
Well, the interesting thing is that public health issues are they're amoral in a sense, because we've got the whole thing about the lack of flu vaccine here.
Right.
Flu is interesting in that, yes, it would be horrible if we lost some of our elderly and our children or whatever because of the seasonal flu that blows through here.
Right.
But AIDS and STDs can cause cancer and death and a lot of other things. So it's not, it's not
take
a
a
big
pill
deal.
and you're okay.
Yeah.
No.
Those don't just blow through. You get one, gives it to two, it just keeps
Correct.
going. It doesn't end with March. So as bad as think about it, if you're concerned about a flu epidemic, think about what a real epidemic is, where it doesn't stop.
I think it's interesting that you bring that point up, because the media, to an extent, does play up what is currently in
Guilty.
vogue.
Guilty.
Yes.
I mean, the news
know,
is
we can-
usually what's now.
If we look at this last summer, how many people died of West Nile? How many people died of HIV? What got more attention in our media?
What's now?
But see, part of that is because I hang out with mosquitoes. There's no morality to mosquitoes.
Right.
There is no, if I were to die of West Nile or get it, people would not spit on my grave.
Right.
I mean, and
Bringing
it's,
us back to the whole issue
and
of
I don't
the
want to stay on
communities
the
being
religion, but
conservative and not wanting to talk about the sex and sexuality.
But Adipur, who's your boss with the Douglas County Health Department, said, don't just, if you're sitting out in Grand Island or Kearney or some of the places where the Nebraska AIDS Project serves Nebraskans, and say, ain't gonna happen here.
Right.
There's a lovely thing that goes across our state called I-80. And things happen in truck stops and places along I-80. In fact, if you follow interstates, that's often an STD hotbed.
Highest rate.
So if you
right
have
along
a
the
daughter
interstate.
or a son and you wouldn't want to deny that anything could happen, you know, they do go, if they live near them, they hang out in places where strangers
Right.
come. I mean, so it's not out of the realm of, but for the grace of God, I was a teenager and I'm still here.
That's right.
Right.
All right.
Well, and beyond a stranger coming in on a truck and sharing a disease with you, how many people engage in conversations with people that they might have sexual encounters with about their sexual history before they engage in that encounter? Does that happen? Is that dialogue happening between partners? Obviously not, otherwise we might not have this rate.
Right.
Well, Carol, you mentioned something else that draws my attention to this process because it's based upon what is comfortable for the media, what's comfortable for the masses to address. It lends, and I know people don't like to throw this word out, but it lends to racial disparities as well.
Right.
And since the masses are majority white or majority Caucasian in this area, do they want to talk about what's going on in the minority population? Do we really care about it from that side? Until it reaches our community, does it really have an impact?
Oh, there's no doubt about it. There are a number of health disparities in all states in this country. One of them, for instance, is the spiking of diabetes in African American, Latino, and Native American communities. The white community is concerned about it as it affects them, but proportionately the other communities are even more worried, but it doesn't get that equal
Right.
attention in news, maybe magazine
but-
format shows.
Not only news, but policymakers. It doesn't get the attention from a policymaking standpoint, from a health care standpoint. It doesn't get the financial aid that it needs. We've been working on this North Branch Health Coalition piece with several agencies here in the city since January, and we're talking to everybody and their brother, if you will. In fact, all of our agencies are on that committee, but we're trying to get our legislators involved. We're trying to get our city councilmen and everyone involved that can change not only the momentum of this area, but they can change policies addressing this. We can get to our school boards more effectively if the policymakers would get involved. That's where the children are. That's where the young people are, and we need to reach them. But we had such I don't know what you want to call it, it's not our problem. You know,
Now who
That was
said
the
that?
response.
Oh.
Correct.
In general, legislators are just not paying attention.
you know-
They're just not paying attention to it, or they're just giving you lip
I mean,
service.
and that's the noose that you say openly. You know, should we call names? Should we
No,
begin
I'm-
to point fingers? No, and I understand that. But I'm saying from the standpoint, it is a legitimate issue that unless the numbers supports the argument, why should I be involved?
Well, recently in the vice presidential debate, the woman who was asking the questions, Gwen Ifill, who is African American, asked Dick Cheney, Vice President Cheney, and John Edwards about the statistics for black women. And she said specifically, black women between the ages of 25 and 44 are 13 times more likely to die of HIV/AIDS than their counterparts. Vice President Cheney replied, I have not heard those numbers with respect to African American women. I was not aware. John Edwards just kind of, you know,
right by it.
and she asked specifically, let's talk about what we can do to financially or whatever to help the AIDS situation in this country. And they both started talking about Africa, which
Right.
is a serious problem, but we
Right
think
here,
AIDS,
domestically.
Africa.
Right. And that's the concern that I'm having even locally. When we look at the state of Nebraska, and Omaha represents the largest African American population, and I heard Jamie indicate even the Latino population. We represent the largest base for this whole entire state, and our county has an epidemic in the STD arena. So wouldn't you think the resources that are associated to fighting this epidemic would be proportionately supportive to where the epidemic is? It would be coming here to Douglas County Health Department. It's not doing that. CDC sends, I don't even remember the numbers per se, but the money is not proportionately directed to where the epidemic is. And we need help. And so when we talk to our legislators, we talk to our city council, we go talk on the door of the governor's office and begin to see how can we get more support. What else do I need to say if I can show you the actual epidemiology data that shows our county is the worst in the entire state? What else do I need to say that we need your help? And if we're not getting it, then it lends me to your question. It's a West Nile virus thing. It's not affecting me. So since it's not affecting me, why should I pay that much more attention to it?
And because that has that little morality thing just kind of stuck onto it. Now you work in STD education
and prevention.
Prevention. And you work for the county, and you're not a political person. You're just a frontline, on the streets employee. What do you have at your disposal that is making a difference? And then maybe we can talk about what we'd all like to see.
All right.
Actually, I have contacts with people like Ramon and Jamie, and connections with the Nebraska AIDS Project, the school board, that there are people that will call me and say, I have a group of young people. I need you to come out and speak. That's what I do. That's what I love to do, talk to young people. I am the person that will go anywhere requested to talk to young people about STDs, HIV, AIDS, teen sex and sexuality. I do it, I believe I do it well because I get requested to do it often. So I'm on the other end of it than Ramon. Ramon is working at it from the top level. I'm working at it from the grassroots level.
Are there enough Kevin Ballows? Is there enough written information to pass to them that's realistic?
No. There's not enough Kevin Ballows or Jamie Grayson's because she's out there on the streets.
And we're going to talk about
outreach.
what she's doing, yeah.
There's not enough. There's really not enough.
Before we get to your programs, because I think they're very interesting and wonderful, I want to talk about some of the things that the North Branch Health Coalition is trying to do. You've looked at, because you have to, as in any advertising, target an audience.
Yes.
Because all the African American young people, let's just target that one for a minute, are not watching the programs that white bread like I am watching. so there is a factor that involves targeting as opposed to blanketing.
Absolutely.
You've looked at some things.
Yeah, we are. The approach that Mothers Against Drunk Drivers took, they took a social marketing approach to reach their constituents, to say basically, it's wrong to drive drunk. And they social marketed, they advertised. They made it a convictional issue in our heart to stop talking about it like it was okay to do.
They made us adopt that as the 11th commandment.
Yes, and then they went, and the next thing they did, they went to their legislators and said, make it a stronger penalty when this occurs. So they did 2 fights. But the same thing happened to seatbelt safety. Same thing. They showed us so many crash dummies going through windshields that we all began to start buckling up because it became real to us. The thing is, what we need to do with our young people today is the same point. Advertise to them, show them that sexual behavior that they're involved in is not safe. Don't just let it fly through our rap songs, don't let it fly through our community without saying anything. Our ministerial staffs need to start talking about it more. Our school boards needs to loosen the purse strings up and allow us to, purse strings, I'm a money man here, but loosen up the legislative side so we can get in and talk to the young people and not feel that we're trying to entice them to have more sex. We're trying to entice them not to have more sex and to be more protective about whatever they're going to decide to do without us. So social marketing.
Also, is there not, I was talking to someone with Planned Parenthood today who sometimes is a dirty phrase, but they've been looking at a program for men, young men, that sort of re-educates them on it. It's redefining macho and everything as with regard to sexuality. So there are other programs too that talk about sexuality first, rather than you could get AIDS, use a condom. Sexuality, changing behavior, about and perceptions of what makes a man and a woman a woman, and I suppose some of those kinds of things, and those work for all races.
It's a more holistic approach, which is definitely effective. There are studies that suggest the more holistic approaches to teen and youth sex and sexuality are much more effective than the abstinence only, or even the abstinence based. You know, when it's holistic, it includes a little bit of everything, and those are definitely much more effective.
Every child doesn't come to the table looking for the same thing at a certain time, moment in time. So we have to kind of be prepared for all those, you know, where they are at any given moment, and adults too, for that matter.
Sure.
I do want to talk about Jamie's programs, because we're talking about prevention, which, Lord help us all. And as I said, I got through teenagedom, but for the grace of God. We all make at least one really stupid mistake, and it only takes one.
Some of us more than one.
With STDs and AIDS. But you're working kind of in the trenches of people who miss the message, or you're still hoping there's some message to get.
Sure, definitely. And you know, to back up a little bit, they aren't necessarily, I don't claim them as my programs, they're all of our programs, and that I work alongside with people like Kevin and with organizations that Ramon belongs to.
Okay, these wonderful NAP programs, Nebraska AIDS Project.
So NAP programs, Nebraska AIDS Project is constantly trying to reinvent itself and develop programming that's effective for the different populations that we're seeing being affected by HIV and AIDS in particular.
And they've been doing that for 20 years now.
20 years,
celebrating their 20. I guess celebrating is a bad word to use.
Yes.
I guess you're celebrating successes, but you're commemorating the fact that it's something pretty serious.
Yes. We've been around since 1984, and we're in offices all across the state of Nebraska. We're located in Scottsbluff, Kearney. We have an office in Grand Island, Norfolk, Lincoln, and Omaha. We offer testing and counseling services. We offer services for people that are HIV positive currently, and then also on the other end where we're trying to educate and prevent so that HIV infections don't spread. A couple of the programs that I coordinate, one of them is called Women on Top, and that's for women that are currently HIV positive. It's a series of workshops and retreats where we work with women on developing condom negotiation skills and disclosure, talking to them about what their feelings are on disclosing their status to their partner, working through their body image issues, depression, empowerment, self-efficacy, you know, all these different, you know, kind of elusive terms that really affect people's lives.
These are still human beings that are living better with AIDS, although we can get into the difficulty of the different drugs and everything, but we're living better with AIDS and HIV than we were before. And so these are human beings that have to go on living.
Well, and we're talking about women for the most part that are still raising children themselves. And so when we add in issues of being HIV positive, possibly living at or below poverty levels, no transportation, issues with medication, feeling sick at times, or feeling very healthy at other times, also raising children on top of that. Maybe wanting to aspire to get more of an education. Maybe they're dealing with employment issues, possibly were employed, but then were fired due to discrimination because of their status.
And do you fight that battle or not when you have so many other
Which hill do you
personal
want to die
battles
on?
to fight? I mean,
Definitely.
And the other program is Street Dogs?
It's called Street Dogs, and it's a street outreach program. It's based here in Omaha. We work in the areas where we have seen the STD rates the highest, because that to us is an indicator of risky behavior where HIV could also occur. Basically, we are on the streets handing out condoms. We just added an element about 2 months ago where we go into bars and clubs. We were looking for specific populations that were being affected, such as young African American and Latinos. We weren't seeing them on the streets in the areas that we were going into, so we tried to decide where can we go to find them. Started going into bars and clubs where we know are frequented by these different demographic groups. And we hand out condoms. We're able to engage in conversations about safer sex. People ask questions, how can I how can I become infected with HIV? How would it be transmitted? Things like that. And we often wonder, how do we measure the effectiveness of these kinds of programs? Where are the outcomes when it comes to this? And we hope that over time we see a reduction in STD rates. We see more people coming in and asking questions, more people coming in and getting tested, more people letting go of the stigma of what HIV traditionally has been, and listening to messages that the North Branch Health Coalition is trying to put out there, that the Douglas County Health Department is putting out there.
But the sad thing is, until some things change, until you get all these things working together that you're trying to get, the numbers are likely to go up, just in the short term.
And Jamie would even say too, and we've been hearing closely with Douglas County, as we get more out there and do the advertising to get kids tested more and to start the treatment, we're probably going to see the numbers increase just because the awareness is actually even out there.
The testing is that's another issue I want to talk about. Even though the numbers may spike a little bit, if people suddenly became aware and feel compelled, this is a righteous thing for me to do, to be tested if I have been sexually active. Are enough people getting tested?
In Nebraska, there's 1.7 million people. Last year, 7,000 people were tested for HIV. I'm not sure that that's an adequate amount of people getting tested for HIV. With regards to STDs, I don't know if we could talk about that a little bit more.
I don't know the complete numbers, and I don't know if anybody's documenting the numbers of people going in to get tested.
Well, and even though these are supposed to be reported, when they're positive, we don't know the consciousness level. We don't know if our doctors are even recommending to young men and women and talking to them, because that's another point of opportunity with, let's say, teachable moments.
Right.
That's definitely an interesting conversation. I go and speak to groups, particularly college level students, and majority being women, and I inevitably will ask the question, how many of you are talked to by your healthcare provider regarding HIV or STDs? And possibly out of a room of 20, maybe 3 will raise their hand. That to me is a disservice the healthcare provider community is doing to the rest of the community.
So bottom line, folks, is there's a lot to be done, and this is a fight that you all can't do by yourself.
Absolutely.
So we're hoping that people, at least becoming aware in their small circles of influence, can have some effect, because you can't do it all. If you had, we have just 1 minute left, and you had one thing to deliver to the population at large in Nebraska, what would it be quickly?
Well, if you have questions about HIV or AIDS and you want them answered, you can contact our hotline, which is 1-800-782-2437, or you can go online to nap.org.
That's right, and you will see that on our screen. Absolutely.
What a start. Obviously, in order to reach the population, we need more resources, and that's not only finances, but more people.
And I'll have to leave you out because time is finite, just like resources.
No problem.
Thank you very much, Jamie Grayson, Ramon Henderson, and Kevin Ballou. And thank you for joining us this week. And take this message to heart. It is an important one.
To view this edition of Consider This or past programs, visit our website at unotv.unomaha.edu. For comments or questions, call 402-554-2516 during regular business hours. Consider This is a production of UNO Television.